Welcome to this series of lectures in which we'll discuss important medical topics. Today's topic is about different characteristics of diagnostic tests that help us in interpretation of results of a test. For better understanding of these characteristics, let's see how sensitivity and specificity of a test is established. Suppose we have a group of people in which we know some people who are diagnosed to have disease and other people are healthy. We have designed a new diagnostic test and want to see how good is this test in detecting disease and identifying people who are healthy. We have applied this test to this group of people and these are the results. We can see our new test is able to correctly identify some people with disease and result is true positive. While other people, although they have disease, the result in these cases is false negative. The sensitivity of a test is ability of a test to correctly identify people who have disease. The formula to calculate sensitivity is true positive divided by all people in this group, that is true positive plus false negative, and multiplying it with 100 will give us results in percentage. Suppose we had 100 people with disease and our new test correctly identify 80 people with disease and result was positive in these cases, and 20 cases had false negative results. So if we calculate the sensitivity, it will be 80%. So our new test has ability to correctly identify 80% of people with disease. We can see the sensitivity of a test deals only with people who have disease. It doesn't deal with people who are healthy, or it doesn't deal with whole group. Before we proceed further, let's see that the overall formula for calculation of all these test characteristics is similar. It's true values divided by all people in that group and multiplying it with 100 gives us results in percentage. All these characteristics are percentage of true results in that group. Now let's discuss about specificity. Specificity of a test is its ability to correctly identify people who are healthy. So a test result should identify healthy people and result will be negative in that case. However, we can see that there are some false positive results. Suppose we had 100 people who we knew were healthy and the test correctly identified 90 people who were healthy and result is negative, while the result is false positive in 10 people who will appear to have disease due to false positive results although they are healthy. The formula to calculate specificity is similar. That's the true results, that's true negative divided by all people in this group, that will be true negative plus false positive, and if we use these values it turns out to be 90%. So our new test can identify 90% of healthy people correctly. Before we proceed further, we'll see that once the sensitivity and specificity of a test is established, it will remain same. The prevalence of disease doesn't affect the sensitivity and specificity value. Suppose we have 1,000 people with disease and we'll see our number of true positive results will increase, as is the number of false negative results, but the overall proportion will remain 80%. Similarly, in people who are healthy, the number of false positive and true negative results will increase, but the specificity remains 90%. So we can see the specificity and sensitivity of a test doesn't change with increase in prevalence. Now we have established the sensitivity and specificity of our new test, and we can see it has ability to correctly identify 80% of people with disease and 90% of people who are healthy. Whenever we'll use this test in future, we'll know that our test has this much ability to correctly identify people who have disease and people who are healthy. Up to now, in our discussion, we knew that people who have disease and people who are healthy. Suppose now we want to apply this test in clinical setting. In that case, we'll not be aware that whether a person has disease or healthy, and we want to use this test. When we'll apply this test in clinical setting, there will be two possibilities. Either the test result will be positive or test result will be negative. If test result is positive, we actually don't know if the result is true positive or false positive. But we have a characteristic of test that tells us how likely a positive result is true positive, and that is called positive predictive value. And it is calculated by similar formula with true results on top divided by all people in this group. That will be true positive plus false positive. If we use these values, our positive predictive value of this test will be 88%. So our new test, if test positive, has 88% chances of being true positive, and it means 88% of chances of a person having disease. So will we treat a person based on this 88% chances of positive predictive value? Yes, we may treat if some conditions like streptococcal pharyngitis, which is suspected, and if positive predictive value of our test is 88%, we may give him antibiotics. However, if we need to perform a major surgery or we want to start a patient on chemotherapy, we want to use tests that have 100% positive predictive value. That will mean there is no false positive case and the person is confirmed to have disease. Now, if the test result of this test turn out to be negative, we have another test characteristics that tells us how likely this negative result is true negative, and that test characteristic is called negative predictive value. The formula is similar, that's true negative results divided by all people with negative results, true negative plus false negative, and this turns out to be 81%. So if the test result is negative, it means 81% of chance of person being healthy and result being true negative. As we have seen that all these test characteristics have same overall general formula, and that's true results divided by all people in that group. We have not discussed about accuracy of a test up to now. Accuracy of a test is combination of sensitivity and specificity, and it is calculated by all true values, that's true positive and true negative results divided by all people in that sample or group. Let's discuss diagnostic tests with different levels of sensitivity. Suppose we have a diagnostic test that tests positive in all people with disease. This means sensitivity of test is 100%. We know sensitivity of test deals only with people who have disease. it doesn't give us information about people who are healthy. We also know that some people who are healthy, they have false positive results. So our test doesn't have capacity to differentiate if the result is true positive or false positive. Suppose we have 30% false positive results with this test, then positive predictive value in this test will be 77%. We can see although the sensitivity of test is 100%, the positive predictive value is only 77%. In this case, we need to perform further tests to differentiate if the result is true positive or false positive. If the result of such a test is negative, it means the person doesn't have disease, because all the people with disease will have positive results. So this means the person actually doesn't belong to disease group and he is healthy. We can see that if the result is negative, in this case it will be a true negative result. And if we calculate the negative predictive value, it will be 100%. So all the negative results will be true negative. This doesn't mean that this test correctly identify all the people, because there are some people who have false positive results and they are healthy. But all the people who have negative results are true negative results, and we don't need to proceed further with further workup for them. So in summary, if the result of a very sensitive test is positive, it means we need to perform further tests to know if the test is true positive or false positive. If the result of such a test is negative, it means person doesn't have disease and we don't need to perform any further tests. We use tests with very high sensitivity as initial tests, and this will include all the people with disease, and then we can perform further tests to confirm if the result is true positive or false positive. Similarly, such tests are also used in screening programs. Suppose we have a screening test for a cancer. We'll perform this test, and this will detect all the people with disease, and some people who are healthy will have false positive results. Then we'll need to perform further tests to find which person actually has disease and which are the false positive results. We also perform such tests where even a single false negative result can have serious consequences, like screening of donated blood for presence of viral disease. Even a single false negative result will risk the transmission of virus to recipient. We can see as the sensitivity of test reduces, there will be some false negative results, and this will result in low negative predictive value. The tests with very low sensitivity can also be used in clinical settings. The sensitivity of a test can be increased by repeat testing in some cases, like fecal occult blood test when performed on one occasion has sensitivity of 10 to 30%. But if we repeat the test on 3 occasions, the sensitivity increases to 92%. Similarly, in case of acute MI, ECG has very low sensitivity in early period after MI. If we combine this test with troponin levels and echocardiography, the overall detection and diagnosis rate increases significantly. So we can combine low sensitivity tests with other tests to improve the diagnostic accuracy. A test with low sensitivity may have very high specificity, like U-wave and ST segment elevation are not found in healthy people. And these signs are very specific for people who have MI. So, as we know, the sensitivity of ECG in early period is very low. These findings may be absent. And sensitivity is only 37% in such situation, with 63% of patients will have false negative results. However, we know these are very specific findings and they will be absent in healthy people. And if these signs are present, it means the person has MI. We can see if the test is negative, the person still may have MI, but if the test is positive, it means the person is most likely have MI. If we calculate the positive predictive value of this test, it's around 92%, while negative predictive value is only 60%. As we know, specificity of a test is ability of a test to correctly identify people who are healthy. If a test correctly identify all the people who are healthy, then the specificity of test will be 100%. In that case, all the healthy people will have negative test results. However, if the result of such a test is positive, this means person is not healthy and he has disease and actually belongs to disease group. We can see another property of such a test is as there are no false positive results, so all the positive results will be true positive in this case, and positive predictive value will be 100%. This means if result of such a test is positive, it means the diagnosis of condition is confirmed. We use tests with very high specificity, especially in situation for confirmation of disease before starting treatment, like chemotherapy for cancer that have significant side effects. We also use such tests before performing major surgery. We also use such tests in situation where treatment will be long term and diagnosis will have significant impact on person's life, like diagnosis of HIV or schizophrenia. Now we have discussed about sensitivity and specificity. Let's see how these tests are used in clinical settings. First, we perform a test with high sensitivity that will exclude most healthy people, and it will include all people with disease and healthy people who will have false positive results. After we have excluded most healthy people, then we perform test with high specificity. This will exclude false positive results and test will be positive only in people who have disease, and this will confirm the diagnosis. We can perform these tests in series, like first we perform test with high sensitivity and then we perform a test with high specificity on people who test positive in first test. However, in emergency setting where a rapid diagnosis is required, we can perform all the tests together to establish diagnosis in short period before starting treatment.